Good evening, students. Today we will see the reasoning out questions in endocrinology. So the first question is why there is a need for second messengers in hormone action. See, hormones acts on the hormone receptors, and there are some hormones they act on the cell membrane receptors because these hormones are water soluble hormones. They cannot pass through the cell membrane. And now the signal has to be conveyed to the target nucleus. For this, we require the second messengers. So because they are proteins, that is water soluble and act on the membrane receptors. Second question, why resorption lacunae occurs in active thyroid follicles? See, due to the engulfment of the colloid by the thyrocyte or the thyroid follicular cells. So in an active colloid, you can see the resorption lacunae, whereas in inactive colloid, there won't be any resorption lacunae. So this is an inactive colloid, this is an active follicle. See, this is a colloid which is not having any lacunae. Here the colloid is having the lacunae. Lacunae is due to the engulfment of the colloid by the thyrocyte. So that this colloid will be taken by the thyrocyte and it will be for exocytosis into the blood. For this step, the colloid is taken by the thyrocyte. Third question, why parathyroid hormone is essential for life? Because it is required for maintaining the calcium level. Calcium is very important and lack of calcium leads to tetany and it is a medical emergency. The next question is why tetany is a medical emergency? Tetany is a sign of hypocalcemia and due to the low calcium level there will be laryngeal spasm and it leads to the death. So it has to be treated immediately with calcium gluconate. IV calcium will be given to treat this medical emergency. The fifth question, why heat intolerance occurs in hyperthyroidism? Already the metabolic rate of all the cells are increased due to high level of thyroid hormone. The body cannot tolerate the heat. The next question, why cold intolerance occurs in hypothyroidism? It's just like the opposite answer. Due to the decreased BMR, the basal metabolic rate is low because of low thyroid level. So the body cannot tolerate further cold. Why edema occurs all over the body in hypothyroidism? It is due to the deposition of mucopolysaccharides. These mucopolysaccharides for the metabolism they require the thyroid hormone. Due to the lack of the thyroid hormone, there will be deposition of mucopolysaccharides and they retain water. So there is edema all over the body and this is called myxedema. Eighth question, why there is exophthalmos in hyperthyroidism? Exophthalmos is protrusion of the eyeballs. It is due to the retroorbital fibroblast and adipocyte proliferation. So what happens usually in Graves' disease? It is a condition with hyperthyroid. There will be autoantibodies produced against the TSH receptors present in these tissues and they will stimulate these tissues and these tissues will go for proliferation. And when they proliferate, they push the eyeball. So this is the orbital and this is the retroorbital fibroblast and adipocytes. They get proliferated. Once they get proliferated, they will push the eyeball. The next question, how exercise reduces blood glucose level? See, in exercise, the blood receptors that is required for the absorption of glucose, they translocate to the cell membrane without the help of the insulin. So that is why exercise facilitates the glucose absorption. Then question, why edema does not occur in primer hyperaldosteronism? So why this question arises is because aldosterone is a hormone that causes sodium and water retention and we will expect edema. But here what happens due to the sodium and water retention, there will be atrial natriuretic peptide will be released, and this causes natriuresis, excretion of sodium, and diuresis, excretion of water, and there is no edema. So even though there is an increase in aldosterone, there is no edema. So the reason is the atrial natriuretic peptide. The 11th question, why there is a poor wound healing in Cushing syndrome? It is due to the protein catabolism, and hence the collagen formation is not happening. 12th question, why pigmentation occurs in Addison's disease? So what happens in Addison's disease? There is low level of glucocorticoids and mineralocorticoids from the adrenal gland, and this by a feedback, negative feedback, it will stimulate the ACTH. So ACTH is adrenocorticotropic hormone, will be stimulated from the anterior pituitary, and that will stimulate the melanocyte stimulating hormone, and that causes melanin in synthesis, and that causes pigmentation in Addison's disease. And just to repeat, diabetes mellitus is increase in the blood glucose due to insulin lack. The next is diabetes insipidus, that is increased urination or polyuria, and it is due to deficiency of antidiuretic hormone. So antidiuretic hormone helps in water reabsorption from the collecting duct. Since it is lacking, it leads to increase in the urine formation. So both the conditions, there is increase in the urine will be there, but here the urine osmolality will be high because of blood sugar level, due to the urinary sugar, and here the urinary osmolality will be very low because of the dilute urine, and there is only water will be more excreted. Here along with water, glucose will be excreted, and here blood glucose will be increased, here blood glucose will be normal. Next is dwarfism, that is decreased stature due to growth hormone or thyroid hormone lack. Short stature, just opposite to gigantism. So you have disproportionate dwarfism and proportionate dwarfism. In disproportionate dwarfism, you have the size of the body will be normal, but the limbs will be very short. The most common condition is achondroplasia. Whereas in proportionate dwarfism, both the body trunk and the limbs will be short. This occurs in the pituitary dwarfism or growth hormone deficiency. The next is myxedema. Myxedema is swelling of the body due to the lack of the thyroid hormone due to the deposition of mucopolysaccharides. So this is a swelling. Then Graves' disease, it is the hyperthyroidism due to the stimulation of the TSH receptors. And here exophthalmos is a specific feature of Graves' disease. So this is the bulging of the eyes, that is exophthalmos. Next is tetany, which is due to hypocalcemia. You get the tetany. Tetany is a sign of hypocalcemia. Then congenital adrenal hyperplasia, it is due to the defective cortisol synthesis due to the enzyme defect, and this leads to ACTH excess, and this ACTH causes adrenal gland growth. So adrenal hyperplasia will be there, and it is due to the defect in the cortisol synthesis and defect in the enzymes. It's a congenital. Then Cushing syndrome, that is increase in the cortisol level. And these are the features of Cushing syndrome. Moon's phase will be there. The protein catabolism will be brewing will be there. Weight gain will be there. Centripetal obesity will be there. And a poor wound healing will be there. And buffalo hump will be there. Then last one is Addison's disease. It is due to decrease in the mineralocorticoids and glucocorticoids. And both the hormones will be decreased. So a classical picture is the pigmentation in the limbs and in the tongue. The next is Conn syndrome, that is increase in the aldosterone level that is occurring in Conn syndrome. Then pheochromocytoma, increase in the catecholamines. It occurs due to the tumors in the adrenal medulla. What are the catecholamines? Norepinephrine, epinephrine and dopamine. Thank you.